Good day, everyone. Today, we will talk about vital signs. What exactly are vital signs? Vital signs are measurements of the body's most basic functioning. Body temperature, pulse rate, respiration rate, blood pressure, and pain are the basic vital signs that medical experts and healthcare providers routinely check. Vital signs are indicators of the vital function of your body. The measurement are used to assess your general physical health. They are the first stage in every medical checkup or evaluation. Vital signs are important because they educate your healthcare professional about any underlying disorder influencing your health and signal your progress towards recovery. Here are a few examples of how we take vital signs.
What is body temperature? Body temperature is a measurement of how well your body generates and expels heat, even when temperatures outside the body changes dramatically. The body is quite good at maintaining a safe temperature. When you are overheated, the blood vessels in your skin dilate to convey the excess heat to the skin's surface. A person's typical body temperature changes based on gender, recent exercise, food, fluid consumption, time of day, and in women, the menstrual cycle stage. A healthy adult's body temperature can range between 97.8 degrees Fahrenheit or equivalent to 36.5 degrees Celsius to 99 degrees Fahrenheit equivalent to 37.2 degrees Celsius. That can be taken orally, rectally, by the ear, by the skin, or by the axillary. The rectal temperatures are the most accurate, but today we will be doing it orally. Here is a video presentation of how to take the body temperature orally. So, good morning, sir. My name is Kenneth Pili, and I am your assigned nurse for today. Are you Mr. Kohan Pili? Alright, sir. So, the reason why we are doing this procedure is to check if you have clinical signs of hypothermia or clinical signs of fever. So, first, I will do my proper hand hygiene, and then I will provide for your privacy, sir. Next, since you're already in your proper position, I will now get the thermometer and then clean the thermometer from the tip all the way to the body. And then next, sir, may you please open your mouth and then put your tongue on the roof of your mouth. So after opening the digital thermometer, you place the tip underneath the tongue where the root is. So wait for the appropriate amount of time, or with digital thermometers, the digital thermometer will indicate it with a beep or a tone. So the temperature of our patient is 36.9 Celsius.
Pulse rate. What is pulse rate? The pulse rate is the number of times the heart beats per minute. Is a measurement of the heart rate. The arteries expand and constrict with the flow of the blood as the heart pushes blood through them. Taking a pulse not only measures heart rate, but also indicate heart rhythm and pulse strength. A healthy adult pulse rate ranges between 60 to 100 beats per minute. Exercise, illness, injury, and emotion can cause the pulse rate to rise and fall in general. Females aged 12 and up have faster heart rates than males. Athletes that perform a lot of cardiovascular fitness, such as runners, may have heart rates near 40 beats per minute and have no signs of illness. Here is a video on how we take a pulse rate. Using the first and second fingertips, press firmly but gently on the arteries until you feel a pulse. Begin counting the pulse when the clock's second hand is on the 12th. Count your pulse for 60 seconds or for 15 seconds and then multiply by 4 to calculate beats per minute. When counting, do not watch the clock continuously, but concentrate on the beats of the pulse. And that's how to take pulse rate.
What is a respiration rate? Your respiratory rate or your breathing rate is the number of breaths you take per minute. When a person is at rest, the rate is normally assessed by counting the number of breaths taken in 1 minute by noting how many times the chest rises. Fever, sickness, and other medical conditions can cause an increase in respiratory rate. When examining respiration, it is vital to note whether a person has any breathing difficulties. At rest, an adult's breathing rate ranges between 12 to 20 breaths per minute.
When assessing the respiratory rate, we need to observe the rise and fall of the chest. One rise and one fall is equivalent to one breath. If the rate is regular, count for 30 seconds and multiply it by 2. But if the rate is irregular, we need to count for complete 1 minute.
What is blood pressure? The blood pressure is the force of the blood pushing against the artery walls as the heart contracts and relaxes. The heart pumps blood into the arteries with each beat, resulting in maximum blood pressure while the heart contracts. But when the heart relaxes, blood pressure falls. Blood pressure is measured using two numbers, the higher value and the lower value. The higher value, referred to as systolic pressure, relates to the pressure inside the artery as the heart contracts and pumps blood through the body. The lower value, or diastolic pressure, indicates the pressure inside the artery while the heart is at rest and filling with blood. The systolic and diastolic pressures are both measured in millimeters of mercury. The normal blood pressure is systolic of less than 120 and diastolic of less than 80. The elevated blood pressure is systolic of 120 to 129 and diastolic less than 80. And the stage 1 blood pressure is systolic is 130 to 139 or diastolic between 80 to 89. While the stage 2 high blood pressure is when systolic is 140 or higher or the diastolic is 90 or higher. And now, here is a video on how we take blood pressure.
We need to expose the upper arm and palpate the brachial area. Snuggle wrap the cuff around the upper arm and insert 3-finger pad to check for tightness and looseness of cuff. And then attach the sphygmo manometer. Place the diaphragm of the stethoscope just above the crease of the elbow. Pump the cuff using the air bulb to around 180 to 200 millimeters of mercury. While listening with the stethoscope, slowly open the valve to let the pressure fall. When you first hear the beat of the blood flow, that is the systolic pressure. But when you last hear the beat of the blood flow, that is the diastolic pressure. The patient blood pressure is 130 over 90. The fifth vital sign is pain. Pain reveals so much about a person's health. Pain impacts not only a person's physical health but also their mental health and quality of life through factors such as mood, activity, sleep, hygiene, appetite, and the capacity to focus and concentrate. Effective pain management requires accurate pain evaluation that nurses are uniquely qualified to assess pain. Because pain is multidimensional, Assessment must include the intensity, location, duration, and description of the pain, its impact on activity, and the factors that may influence the perception of the pain. Lastly, the pain scale is the most effective technique to ask a patient to describe the pain that the patient is experiencing.